at the end of the road, in my opinion, of the treatment options. And I actually just went to a meeting of what's called an expert user course. So these are people that are very experienced from around the nation that are coming to learn from the world's experts and the inventors of devices, et cetera. And it was interesting to hear what was the threshold for each of the super experts on the panel to offer the next step or the end of line treatment, in my opinion, which is called a penile prosthesis. Probably it should be offered earlier in the game, but I generally want to see that patients have gone through that gamut of treatments. I want to see them show that they tried pills and failed. Why would we want to do surgery if pills work? I want them to show me that they're at least motivated enough to try shots. It's not that they have to stick with them, but in my practice, I want to see that they're at least willing to try it. And if they try it and they say it's just not for me, or they've tried it and it's gotten worse and now it doesn't work, or the person who would like it to work and it just doesn't work, these are the people that I'm going to offer a penile prosthesis to. A penile prosthesis is a surgery. It's a relatively simple surgery. It's not without complication. So again, this is where that motivation, in my opinion, comes from. Patients are not to be talked into a penile prosthesis. It's a surgery that might take around an hour to do. In essence, it's a marvel of engineering, and most people have what we call a 3-piece prosthesis. And what that is your penis, if you were to look inside of it or cut it off, you would see that it's basically made up of 2 what I call shotgun barrels. It's a triple-barreled shotgun. The one underneath you urinate through. But these 2 are the ones that get hard. And what's happening here is you just don't have the blood flow to flow in to get them hard anymore. So the operation, in essence, is a means by which we hollow those out and we insert a prosthesis, which is a very fancy balloon. It's going to fill with water instead of blood. If it's going to fill with water, there has to be a place where the water comes from. That's a balloon that we implant up underneath your abdomen so you don't know where it is. And then there has to be a way to pump the water in. That's a pump that goes into your scrotum. There's different ways to do it. This was one of the reasons I went to this meeting, so I could see many different ways to do it. We have to shift the ways that we do it sometimes on the patient's anatomy. But in general, patients that choose a penile prosthesis are patients with partners that are very interested. They're patients that are very motivated. And if you have those 2 combinations, they tend to be the most pleased of any group of patients in terms of patient satisfaction with their choice of having a prosthesis. It's something that is going to work when you want it to work. It's spontaneous. The act of inflating it is usually worked into foreplay. So it's a device that may need to be fixed at some point. It may have a 10-year span where if the patient is lucky enough to still be interested, they'll get it fixed or replaced. But in general, it's something that is not a very complicated operation. There are complications that can happen with it, but the patient satisfaction is excellent. And if I see that right patient and it looks like they're a prosthesis person, I generally will really push them to look into it because it tends to be the key to their happiness.